as Helen kindly introduced us, we work in a partnership model between Young Somerset and Somerset NHS Foundation Trust, and we have been part of the Trailblazer since 2019. We have teams now across Somerset. We're always looking at how to strengthen those teams, and we're just going to talk to you today about some of the challenges and the positives that we've found along the way. So, as we all know, there are three core functions for the mental health in school teams. For us, one of the biggest ones that's often forgotten about, that we work really hard with our schools, is about the MHSTs were set up to help young people to get that right support to actually stay in education, and how we can make sure that that happens before it gets to a point whereby they have left education and there's a lifelong impact for that. This is a tri-model between Young Somerset, Somerset Foundation Trust and Somerset County Council. So Young Somerset, we are the employer for the EMHPs, and we also have assistant practitioners, and we line manage staff and also help with safeguarding and the general kind of HR that goes around with the employment. Our colleagues in Somerset Foundation Trust employ the senior mental health practitioners, supervisors, and also the whole school approach practitioners, as well as the clinical leads, which Kate is one of their clinical leads with Thomas, who's kind of does that work with Kate. We spend a long time making sure that we are working closely together, and it's a really good model in terms of the communication between us and the joint working model. Somerset County Council provide us with our educational psychology service, and we also work really closely with our public health colleagues and the general education service as a whole. So Young Somerset, we are a charity. We've been running for 25 years in Somerset, and we have three strands to our organisation. So we have youth work, which is mainly targeted youth work. We have really successful projects running with young people, and again, in lots in collaboration with our public health colleagues, Foundation Trust colleagues, and the County Council. We have alternative provision for those young people who need to develop some skills in outside of the school environment. So again, we work closely with them, and we also have a shop in Taunton whereby young people can make and sell products and use it as a base to work with other young people using our tech lab and generally helping to make a difference for their lives. And then we have our biggest strand, in a sense, of the mental health and wellbeing. So we have a community wellbeing service and the mental health support team, and we also commission to run the Somerset Big Tent as well. So the main strands, we know community wellbeing practitioners and education mental health practitioners generally deliver the same interventions, running the low intensity CBT for young people. Main difference, our community colleagues work, as it says out in the community education teams, work with specific schools. We also, with the mental health teams, everybody knows, help with that whole school approach. And both teams, we have assistant practitioners who are non-clinical staff who support our practitioners, but they also provide a wealth of resources and engagement opportunities for children and young people. So we have a bit of a stepped model in terms of some young people work with our assistant practitioners before working with either our CWPs or EMHPs. So Kate, over to you.
Thank you. Yeah, this is just to show how the MHST fits into CAMHS, because I'm sure a lot of you probably are aware that CAMHS is just a number of services under a big umbrella. So this is just to show that we've worked really hard within our local CAM service to develop a better early interventions offer. So MHST fits so lovely into that. So we've got our single point of access service, which is basically the front door to the CAM service. And then MHST fits really nice into that. So we're kind of within the CAM service, working closely with the education and just trying to get those young people the right support really early on. And then we've also developed a Tier 2+ service within our early intervention service. It's a kind of next step up from MHST, where they maybe don't meet our criteria. And then obviously there's lots of other specialist CAM services all under that big CAMS umbrella. So yeah, that's how we fit in. This was just a kind of a reminder of the remit really. So this is just an example from around low intensity CBT and what we can work with within MHST in Somerset, and things that we can't work with. And this can be a bit of a challenge, which we'll probably talk about a bit later. Just trying to help our wider services understand our remit, as well as us understanding our remit as well. So this is just a kind of a bit of a snapshot really of what we offer in Somerset in MHST. So we've worked really hard in trying to separate out our offer. So it kind of just gives a nice overview. So it's not just about the one-to-one support, the low intensity CBT. There's so much more that we offer in Somerset. So we offer a good selection of whole school approach support for schools, because this is an area that schools ask for lots. So we've really built on this, and that's where our assistant practitioners and our whole school approach practitioners come in, which are separate to the educational mental health practitioners. So that they kind of really target the all of the young people in the school, not just those young people that have been identified for MHST support specifically. So that's where the large group and assemblies come in. We support, so for example, this week with Mental Health Awareness Week, so there's lots going on around mental health awareness, putting up boards in schools, making sure that we're promoting mental health as best as we can really. And parenting support as well. So within the EMHP offer, the EMHPs can do some work with parents, but we also are able to offer some group work for parents and information sessions. And also the staff wellbeing, staff sessions, staff training. So it kind of just gives an overview of everything that we offer. And at the top there, you'll see mental health lead supervision, which is delivered by our educational psychology colleagues. So they offer supervision specifically to mental health leads in schools, which is just invaluable really. And we also look at audits as well. So we've got a varied couple of audits that we support schools, so they can look at where they're at and what are the things that they want to improve on, and then we look at how we can best support them to achieve that really. So becoming a much more mentally healthy school really. So this is just an example of who we're working with. So we, with the MHST, it kind of comes in waves. So we were part of wave 2 and we took on 2 areas. So Somerset is actually quite big and quite spread out. So Taunton and Mendip areas are quite big, but what we're covering mostly is quite a chunk of the secondary schools in all of these areas across Somerset. And then we've got a selection of primary schools. And we've also worked really closely with our pupil referral units. So in each of the areas there's a pupil referral unit. And we're working quite closely to keep the link with the head teachers there to ensure that, because they've got a really good overview of all of the schools. So this isn't all of the schools in Somerset, because we have a lot. This just and that can cause some issues when people are finding out a bit about MHST and they think, oh, why are we not part of MHST? Which is good and exciting. So we're hoping that we can go further over Somerset. Yeah, so this is an example of process. So we've spent a long time trying to work out our processes and scratching our head and banging our heads to try and make sure that the processes are right for us and for school. And I think, again, we'll talk about this in some of the challenges, but it's quite difficult working across services and with education partners, and everybody has different ways of doing things, and then trying to develop a service and find a process that kind of works. And yeah, it takes a bit of time. So yeah, I don't need to go over this, but this is just a bit of an example, and I think you'll be given these slides. So to show one of the processes that we follow to try and help schools to identify young people that they think might benefit from support from the MHST, and then how we would follow that process through to ensure that that young person hopefully receives the right support, whether that's with us or whether we can then look at signposting to other services.
So I think this is me now. Thank you, Kate. So yeah, we just really wanted to give some time to talk about kind of what our sort of key sort of bumps in the road have really looked like, and share that with you, and obviously look ahead to how we're planning to overcome those and what we've already put in place as well. So one of the challenges that we found is obviously the supervisors and the EMHPs have been training simultaneously in some cases, and that has proved a slight challenge, obviously sort of learning together and going on that journey together, learning the interventions and the kind of routine outcome measures and how to use those in practice together. So that's been a little bit of a journey. Obviously establishing the awareness of the MHST service among schools, so really getting that identity out there, so as sort of every member of that school community knows that they're an MHST school, what it does, what's on offer, and really kind of pushing that identity out there, really, as alongside, as importantly, what is our remit. We all are well aware that there's gaps in the kind of system that exists, and so really trying to be clear about what we can and can't work with, and also supporting schools to find, when it's not us, to find the right people that might be able to help. So really trying to have that joined up approach, and trying to fill those gaps by other services, and not just trying to sort of fill them ourselves, really, is quite important. Yeah, engaging schools, really. So when we've been sort of establishing in different areas and in different schools, I'm sure this has been a common theme sort of nationally, really, but really trying to engage schools in taking an active role. And I think that the mental health lead training has really pushed that on, and seeing their role in their engagement with the service. And, you know, particularly when the team are in training, obviously they're having a lower caseload. So, you know, trying to let schools know that, yes, you have got this service, but actually, you know, we're sort of still getting going, and caseloads are going to be lower for a while. So that's been a little bit of a challenge. Staffing is in red there, because I think this is quite a kind of a national issue, really, with recruiting, not trainees, because I think there's an abundance of people that really are excited by the EMHP role and really want to be a part of MHSTs, but recruiting kind of already qualified EMHPs into Somerset has been a challenge, and as well as sort of retention, really, because, you know, looking at kind of the progression routes that an EMHP can have, because it is still a new role. So that's very much a sort of up and coming thing that's being looked at. And, you know, I'm really lucky that in Young Somerset I have had that progression sort of opportunity for myself, but what that looks like sort of clinically in terms of progressing onto the supervisor training and things like that, that's, you know, still a kind of a work in progress, really. So we did. I was just going
to say more about the staffing, really. I think this is probably the reason I put it in red, is because it is probably one of our biggest challenges. And I think Sarah, Lisa and I were not here at the beginning of 2019 when it started. And we've had so many staff changes in the short time that we've been here. And our first wave, all of our first wave of EMHP trainees are no longer in our service. So I think that just kind of gives an overview of just how, I guess, difficult that's been when we're promoting a service and trying to embed into schools, and then actually we don't have the practitioners to deliver what we've said we would offer. And that has been a real challenge. And as Sarah said, trying to then fill those gaps with qualified EMHPs, there aren't any because it's new. So it's been a real challenge to keep schools on side, I suppose, to ensure that they're staying with us through this journey, and that that has been, yeah, I would say that's probably one of our biggest challenges.
And to kind of add to that as well, that people who have moved on from the NHS team have kind of stayed within the world of mental health generally, because it actually does open up a lot of doors for people. And we've really recognised that, so Sarah kind of alluded to, we've been really looking at kind of that career pathway for staff, so that there is always something to work towards and to, you know, to help to retain staff. And we have actually now our trainees who join us actually have a training agreement that's over 2 years, so you know we can kind of really help to move the service forward, because we know we've got those staff for at least 2 years, if not longer, and actually really help to embed them into the service.
Yeah, thank you. Yeah, so yeah, waiting list to consideration list is basically we moved from the senior mental health practitioners that sit within CAMS, from holding those waiting lists and managing those to schools holding what's called consideration lists. So the senior mental health practitioners will meet with mental health leads regularly and talk about the young people that are on that school's consideration list. So they are discussed and considered for MHST support. So that's been a fairly recent change that's happened, and you know, schools have needed a bit of support in that, and you know, we're now sort of looking at that model and how that sort of triaging happens, and sort of starting to try and bring EMHPs into that process a little bit as well, to try and bring their kind of say into those discussions, and to really find the right support for that young person at that right time, which is a real positive. But that has been a shift that we've seen in our service. Just basically figuring out roles and responsibilities really within this TRI model. So, you know, obviously we've really worked hard on strengthening our partnerships between obviously Somerset Foundation Trust and Young Somerset, and you know, figuring out, okay, who's doing what, how do we fit together, what does that look like, and the processes around that, and not being afraid to sort of say, okay, this isn't working, let's change this, let's do this slightly differently. Because there have been those bumps in the road, you know, naturally there's quite a lot of people, but you know, different teams, so yeah. So as I said, communication among the TRI model has been a key thing that has been a slight bump in the road for us, and that we're really focusing on. We have regular meetings which involve Young Somerset and CAMS, where we come together in a really nice location in Somerset, actually, called Dillington House, which is a lovely venue that we've got use of, that we can book, and we just really build those relationships and talk about how things are going and how we're working together. Booking rooms in schools has been a bit of a challenge sometimes. You know, schools, as we know, then there isn't always the space there, or at least the regular guaranteed space. So we've worked really hard to try and ensure that actually schools know what days their EMHPs are going to be in that school. That room is booked out for the whole day, and you know, really trying to get that consistency really for the young people that are seen there. We've already sort of talked about recruitment and retention of EMHPs among that sort of wider staffing issue, so I won't go over that again. One of the really key things that have been quite a bump for us really is working across two systems. So our colleagues in Somerset Foundation Trust will use Rio, they use the Rio system, and our EMHP practitioners use IAPTUS. So the supervisors in CAMS do have access to IAPTUS as well, but obviously EMHPs don't have access to Rio. So that has been a challenge, and we are sort of currently looking at how that can be looked at and worked on, and get some sort of communication between the systems. And obviously that does affect how we kind of pull off our data and how we can report that data. It's, you know, that process is a little bit more lengthy and complex than maybe if we were on just one system. So that is a bit of a bump with the TRI model for us. Our whole school approach offer, obviously that's been really affected by COVID, and also having the staff available to actually really run with that. You know, what we know is schools have a really strong need for whole school approach work, and you know, a lot of schools are really enthusiastic and, you know, really on board with wanting that. And it's about looking at sort of having a fair offer across the MHST schools, and how we can staff that, and how we can try and get that off the ground to do that sort of more preventative work. So working alongside school nurse and school support systems, obviously there are already other kind of mechanisms and professionals in place in the school. So really establishing our sort of communication with those groups and building that partnership working is something that is still very much happening for us in Somerset. Kate, did you want to say something a little bit about the Band 6 options?
Yeah, I think this has been a bit of a challenge, and I think part of the reason why we lost some of our EMHPs after qualifying is we didn't really have a huge offer for progression to supervisor, and that's partly our fault on the NHS. Well, it's all our fault on the NHS side, in that we have this thing where you need to have a core profession in order to be able to be a Band 6 at the moment, and that has been a bit of a challenge in then being able to support EMHPs to do their supervisor training, which would be practicing at a Band 6. So that has been a difficulty in being able to offer staff progression opportunities, and some of the reasons when we've done exit interviews, that has been part of the reason why people have left us and moved on to other things.
Yeah, thanks, Kate. Obviously, it goes without saying the impact of COVID has been massive. So really having to shift our work to being virtual and all the complexities that has brought. But I would say it has also opened up some opportunities as well. And looking at, okay, we can do this. We can offer a service that isn't necessarily face-to-face, but it's not always the ideal option for a lot of young people or practitioners as well, actually. The university course itself is obviously, it's quite intense, it's quite a big undertaking, and you know, something that we're looking at with our newest trainees is really that transition from being solely university to progressing into practice, and so that has been a little bit of a bumpy road for some of our trainees, sort of taking on that course. So really the key messages for us is that trial and error, it's, you know, every day is a school day, as Kate has put here, because actually some things aren't going to work. And whilst we were part of the Trailblazer sort of scheme in 2019, we've had COVID to deal with among that. So we really are still kind of like finding our way and trying new things and looking at what's working and what's not working. And I think that'll be the case sort of ongoing, really, and probably for a lot of them.
We are constantly learning, aren't we? We're always working things out together. And I think that's the good thing about having the two services working closer, is that we're just constantly having conversations about, well, we're doing it this way, but that doesn't seem to be working, so maybe we should try another way. So we're all, it is, every day is a school day for us, for sure.
Absolutely. So one of the things that we're looking at moving forward is some of our management team have been, myself included, been on or are starting the Children and Young People's IAP to Leadership course, which so far has been brilliant. Lisa, you've been on that, haven't you? And it's really, really good. Really recommend it if you get the chance. Yeah, really, really a fantastic course. So again, we're looking at the career progression for EMHPs, and looking at we've actually put in place some salary banding now, haven't we, for the practitioners? So looking at giving them a sort of a consistent offer that might replicate what is available in other roles, in order to help that retention, really. So my particular, as Helen mentioned, focus as service manager is school engagement. So we're looking at kind of having a relaunch of the MHST. Now we're moving out of a sort of COVID world, really, although we are still in it, obviously. Building those relationships with mental health leads and looking at holding like an MHST annual conference and all sorts of these exciting kind of new ideas that we're working on to really try and boost the relationships around the MHST. We've got a new staff learning portal that has been put together and is available for our EMHPs. So really being able to track and sort of give them a pathway, really, in terms of their continuous professional development, in line with obviously line management and their own passions as well. We're currently developing a practitioner handbook for our whole sort of mental health and wellbeing team, including the children's wellbeing practitioners as well as the EMHPs. So we're hoping that'll be a really strong asset, particularly for our newest trainees coming out into practice, to be able to go, right, let's get down what it is we are doing and what those processes look like. We're also looking at the development of an app for young people's engagement with their interventions, so a place where they can access their home tasks for that week if they've forgotten, or really have a grip with their their sort of MHST support really, and improve that access and that communication around their support, which is quite exciting. And we now have a logo and an identity that we're sort of still pushing forward with and really trying to promote in Somerset to get that sort of widely recognised and understood really.
I think that's, yeah, I think the logo and the identity it's just ridiculously exciting for us, because it just keeps us, well, us as services united really, I suppose, in that we've got our own identity. We've got NHS and we've got Young Somerset, but actually as an MHS team we've now got our own identity. And actually then thinking about how we can build on that and create resources with our logos on and promote ourselves in schools, and it's amazing how just what a difference that's made, I think.
Yeah, absolutely. We have got an early years pilot running at the moment as well, which some of our staff are involved in. So really looking at a kind of providing support really early on and connecting with parents and looking at sort of putting in place that preventative engagement work, I guess, really, and that really early support offer that's happening at the moment. Is there anything else you want to say on that? Or?
Which was
early years pilot.
Yeah, I mean, we're consciously aware that you know, the early years, especially after COVID, we've got young children who are starting at school who have not been able to access kind of preschool, nursery, and we've been working with our colleagues in public health and county council to run a small pilot to actually look at how we can work with parents and the young and very young children at the same time. So we're really excited, and we did a test and learn phase in the autumn, and our pilot starts in a couple of weeks. So,
and having a close sort of working relationship with our commissioners as well. You know, that's been something that's been sort of worked on quite a lot, and really getting to know those and build that relationship, meet with them on a regular basis and have that really close contact. Anything else, Lisa?
Yeah, I think the main thing with that is actually about the honesty, because we are really honest and saying when things aren't going right, and actually they work really closely with us to help overcome any barriers rather than trying to hide things and think, oh, it'll be sorted out. It's actually, honesty has just been the best way forward on both sides, because it actually again helps to solve some of those issues we've had, and just come at things from a different angle as well. So yeah, I would agree. I think it's that kind of supportiveness from our commissioners to know that they want us to succeed and therefore not pushing us to, you know, with pressure. There's no pressure to go over and above. We actually need to do well what we're doing at the moment, as rather than pushing and trying to do more and not do that so well. So that's been so refreshing, I suppose. And also things like just supporting around staff retention and helping us to find ideas in ways of which we can do that. And CPD has been, you know, being able to purchase training for people and opportunities to help support the team and keep them happy and engaged with us, really. So that, yeah, it's been really great. And a shared development of resources is something that you know, really excitingly we can benefit from in this tri-model, really, and that we have a wealth of experience and resources across our teams that obviously all kind of come together within the MHST, and looking at what do we already have, and not sort of reinventing the wheel, if you like, but actually working with what we've already got and making that sort of suitable for MHST, and yeah, just acknowledging that we've got a lot across our team that is already there and we can really benefit from and pull from. We are always, as we said, reviewing our processes and procedures to make sure that the way we're working is really effective and efficient. So, you know, sometimes there are things that have come up where it's like, oh, actually we're duplicating here, and, you know, in terms of sort of recording or just the way that things are done. So really looking, and I think that's something that's really quite exciting about my new post as service manager, is that we have got that link between the senior leadership team and the practitioners on the ground to be able to look at things in a much more broader way and say, okay, how is this working, how is this not working, and what can we change here to make it more effective or more efficient. And within that, some increased administration support as well. So our assistant practitioners have been invaluable in terms of their role within the EMHP,
kind of team, the support that they provide, not just administrative, but as we said, sort of non-clinical support, and their resources and their wealth of knowledge and experience that they bring. And obviously we have administration support within Young Somerset as well as within the CAMHS team, which just makes our lives immensely easier, so which is brilliant. And the training that's offered to staff in the MHST from the education psychology team has been absolutely amazing, because they are often reaching out and saying, right, what do you need? Which is just so powerful, because you've got something that is entirely sort of tailored and responsive to what the team needs at that time, which has just been absolutely fantastic, and our relationship with them is really, really great. So yeah, that's been really positive. As we said, we're looking at just embedding the CAMHS and Young Somerset teams even further, as much as we possibly can. And the way that young people and parents and carers are engaging in the development of the MHST, we really want to kind of strengthen that, their voice within that. We've actually got a service manager who's focusing on participation for the mental health and wellbeing team, which is really, really exciting. So we're hoping to get those groups kind of up and running really, and making it really led by them.
And with just to say, within the CAMHS team, we have a participation group as well. So our young people we've used for interviews as well within to employ new staff members. And I know Young Somerset are doing the same. So it's using young people to be part of the whole process. Yeah,
absolutely. And we've already talked a bit about sort of collecting and collating data and feeding that back, and how that works across the teams, and really having a focus on making sure that that's as efficient and as accurate as it possibly can. That is one of our key focuses at the moment. And there is a new referrals portal that is being worked on for the sort of all early intervention services, which is going to be really exciting. So it's effectively having kind of one front door really, if you like, and then requests can then be filtered to the correct place. I don't know if you want to say any more on that, Kate or Lisa.
No, it's just something that's in development. I think we've realised that we've got GPs, we've got schools, we've got school nurses all putting different referrals in for young people and not really sure where the best place is. And actually we just want one place for them, and then we'll do the rest of the sorting out and working out of where that young person may need help from. So yeah, we're really excited at the prospect of this.
And you have a new kind of office space for early intervention services, don't you, Kate, your end?
Yeah, again, this is really exciting for us in CAMHS, because we're really kind of trying to separate out the early intervention service as a actual, we're actually going to have a base, which is very exciting, and we're not, it's just going to be a really good hub for us to be able to kind of just helps with everything, communication and sharing of resources, information, having general case discussions. It's just, it's going to make our lives a lot easier.
And obviously we've already mentioned that we're kind of developing our whole school approach offer, and that is, we've got a wealth of opportunities within our tri-model actually to do that, because we've got the whole school approach practitioners, as well as our assistant practitioners and our EMHPs that all kind of fit together to provide that offer, which is really great. And just we're really keen and in sort of progress really to link with other MHSTs to share the learning really, and to reach out. And that is one of the great things about this leadership course actually that I'm currently on, and that Lisa's recently done, is that you can all get in one room with other MHST colleagues and really talk about what's going on and what are the challenges and what are they trying and what's working, what's not working. So it's a really powerful space. And in terms of my engagement role, it's something that I'm really, really excited to do more of. So yeah, that's a key one for us.
I just go back to that one. We one of the most valuable things for us was actually linking with I think the Bristol team, and actually going up and visiting and just seeing how they do things, and actually it's refreshing and reassuring to know that we are kind of doing similar, but also amazing to come away with ideas about how we can progress and develop our own side of MHST. And I guess it's remembering that you're not on your own, and there are other people out there probably trying to do the same and scratching their head around the same sort of thing. So yeah, it's just great to know that there are other people having the same issues and trying to communicate and talk about those.
Yeah, and particularly other areas where their MHST looks quite similar to ours, so where they have a joint offer for the MHST that's linked up. That can be really, really important to collaborate with those areas, because they're going to experience similar challenges to us, really. So yeah, I think that's just about us done, and we're really, really keen, as Helen said, to kind of get your questions and try to answer them as best we can